Why should patients come here? Why should patients come to Advent? What separates us from any other ENT around here? Because there are other patients that see other ENTs and they've been following for years. Like, why are we different?
Yeah, I mean, why are we? We are different. I guess I'd say, I think sometimes we get called out for being different.
Absolutely.
True?
Very true.
When in fact, that's intentional.
We want to be different.
We want to be different because, in my opinion, the standard of care in medicine is it's not up to my standards.
Well,
it's not up to what people should expect out of the care that they receive.
100% agreed. Because the standard of care, by definition, is whatever the standard of care is in that community. In general, that's what that means, which doesn't mean anything. Because what if it's rooted 20 or 30 years ago, or just wrong? You know, and so you try to do we got to do what's best for patients, and so that's why we're different.
Yeah.
Like you said.
Which is, and we're, I guess here's what I'd say: we're different not because we choose to be different; it's because we choose to do things in the manner in which we feel like they should be done. That makes sense. Meaning we both came, and everybody in Advent has, come through the traditional medical model, and we've left that in the dust, moving on. And what's the difference? I'd say the core difference between what we do and what's done elsewhere is we wholeheartedly believe with every ounce of our heart that that we want to get somebody better. We will do everything in our power to make somebody better. Now, what does that mean? It means we need to understand what's going on. And in order to understand what's going on, we need to use the right tools to get that information. I don't feel comfortable doing things when I don't have the information that I know is easily accessible.
Right.
Yet, there's a price to pay, a literal price to pay for some of that information. For instance, at our first visit, when somebody comes into the office, we'll typically do what's called an endoscopy, which is looking with a camera into the nose, the back of the throat, down around the voice box to see what's there. Mm-hmm. Why would somebody want to do that?
Well, why are we different than a primary care doc who can't look in the nose, right? So we can take a scope, we can look in the nose, we can see the anatomy, we can see inside the throat. Think about how many common nasal and throat problems there are. Like, that is the best tool out there to look inside there with our own eyes and see what's going on.
And if you had that tool and didn't use it, and yet somebody has an issue that you could have seen with that tool, how is that possibly at all with somebody? So if somebody comes in to seek treatment for us and we don't use the tools in our arsenal, why wouldn't we? It's some of this sort of, I get confused sometimes with the premise, and the premise is that we should move forward confidently with less information. When in fact you can't move, I think for us and for me and for how we do things is, once we have the information we need to understand what's going on, then our job is to educate somebody about that information, what the information is showing us, and then if we choose to do something, we do it with confidence and conviction because we know the information. Now the standard of care is, hey, let's just, we're just going to just do, we see that your septum is deviated, for instance. Why don't we just straighten that septum? We don't need further information. Your septum's bad. It's like this weirdly, it's this ignorant mindset that is the typical mindset that is inappropriate. If it were your nose that you're going to have, if you have a deviated septum, which you do, I know this, that you need to get corrected.
Hey, everybody's septum is deviated.
So if you have a deviated septum, and I'm going to take you to surgery, and wouldn't we want to know everything else that might
I would want
exist?
you to know everything else if you're taking me to surgery, because I think both of us can agree that sinus problems, a complaint from sinus issues can be obstruction or congestion, correct?
Yeah, absolutely.
Okay, so why would I ever want to take somebody to the operating room if their main complaint is obstruction or congestion if I didn't get a CT scan to actually look and go see what's going on with their sinuses?
Yeah, absolutely. And I think that's the question. And I put the question out to the world is, why would you want to move forward with less information versus more information, especially in areas that you cannot see? Right. So the sinuses specifically, neither you nor I nor anybody else on this planet can, without X-rays, see what's happening in somebody's sinuses. You cannot know. It's impossible. You can't see in those areas. Right. So why would you think to do anything without imaging, for instance? So
an essential tool that we have is CT scanners in our offices. Now, for that reason, right? Let's get imaging, let's see what's going on in sinuses. Now, patients could maybe see other providers and then drive elsewhere to get a CT scan, but that's still essential. But that also then is the reason why maybe that's not ordered at times, because patients have to go to an outside center to get something done, and then there's time, and there's effort and follow-up, and there's phone calls. But maybe it's spun, or it's just in a way that a patient's like, oh, it wasn't necessary. But the reality is it is necessary, and so we try to make that easy to use the tools that we have to give the patient all the information they need.
Yeah, because that's what you would want me to do for you.
If you were a pilot,
and that's what I would want you to do for me. That's what we do for everybody, and I think, and that's the standard. Like, that's the standard, and absolutely, because it's crucial information for us to have before we think towards. We cannot know. We can't know without that information. It's just impossible. Because it's crucial, it's important that we have office-based imaging in every one of our offices, and that's crucial because we need that. Now, if you didn't have that, lo and behold, you would be getting less images. Lo and behold, you'd be doing things without imaging because, boy, that's a hassle to go get that image. Let's just sort of nip and tuck here what we can see, and let's hope we don't have anything going on. And you better not be nipping and tucking me without the information. You know what I mean? It's not appropriate. I wouldn't do it to my mother, my wife, my kids. I wouldn't treat them without imaging.
Which is why it's discouraging sometimes when we see patients that have had things done, whether it's septums and maybe some turbinate work, that still have problems or didn't get their initial problems resolved. And so it's just always like, well, was there other issues there that maybe weren't identified? And you just don't know the answer to that question, without, again, getting a scan and evaluating the entire thing. Correct. And it's no different than a pilot having a flight plan and being able to see and having instruments and controls. Like, think about a pilot flying without that. Would you want them flying your plane? Probably not.
Absolutely not.
And so would you want your surgeon doing something without understanding as much information as they could before making some sort of decision with you, the patient, as informed as you can be?
Right. Yeah, I guess the challenge in my head sometimes, I don't understand the counter argument, because there is none. There is none. There's none other than maybe you're going to get lucky. Let's cross our fingers. Let's go in. Let's just take you to surgery. We're going to straighten this septum out. And boy, I'm going to hope and pray that you don't have anything going on that I can't see. And you know what? If it happens, tough luck, kind of a thing.
Well, what about the patient that's unlucky that says, hey, you go in, maybe you have your septum straightened, nip tuck, whatever kind of thing in the nose, and still have congestion on the back end. Then, if you're a doc and like, now let's get imaging, then of course the question's going to be like, why didn't you get
do that beforehand?
Exactly.
Why wouldn't you?
Right.
And there's no answer.
There's not a good answer.
There is no answer. There is no, unless you don't have don't have the ability to do such a thing. Right. Fine. Now, again, for the conditions that we treat nose and throat issues. We are nose and throat specialists. We have multiple tools to look in those areas to figure out what's going on. There are most doctors, most ENTs don't have the same tools we have here. Fine. Therefore, like, their choices are to move forward without that information, or just sort of leave it alone. Mm-hmm. And so for us, if somebody comes in and gets treated, we're going to use the tools that we have to evaluate what's going on. Yeah. And primary care docs don't need nasal endoscopes. It's not something that they need. Now, if they had them, and if you could see in those areas you want to see. Same thing with imaging. There's tools that you want to use. That you need to use, that you have to use to see. And
so one of the things that separates Advent from everyone else, the tools we have in our toolbox to actually address patient concerns.
Yeah, absolutely. Tools information is powerful. Without information, you're powerless. Take your choice. Powerful, powerless. We choose powerful every day of the week, and that's our bias. So if that's sort of a controversial or biased opinion, then let the controversy and bias reign. Yeah. Because I don't understand the counter argument to that, and I never will, and we never have to, thankfully, and nor do our patients, thankfully.